So today is our 10th COVID video update for our staff and community. We just want to continue to say thank you for everything that you're doing. Thank you for coming in, taking care of our community, taking care of our patients. It's a long marathon that we're all in right now, but we are being successful, and we are doing what it takes to continue to serve our community each and every day, and it's all because of our staff, and we want to say thank you once again. So we have certainly seen an increase in our COVID-19 patients over the last month. Thankfully, we've seen a little bit of a break in our positive testing results over the last week or so, and we're hoping that that results into less hospitalizations coming in the next few weeks. We'll have to wait and see. We're hopeful that that's going to be the case, but we're going to be prepared for the worst if it turns out not to be. So our message is the same for the community as it has been throughout this process. Stay diligent. Stay social distancing, keep wearing masks. Wear masks anytime that you're out and you're in public or when you're with other people. We are continuously monitoring our capacity at the hospital. I'm happy to report right now we do have capacity in this organization to continue to do non-emergent cases, to continue to see people in our ER, to continue to have people be admitted and even into the ICU. This is something we look at on a daily or actually multiple times during the day and make judgments on that as we go through the week. Right now, we are not deferring any elective cases. Sarasota Memorial has been very active in research activities around COVID-19. We're in our third trial now, and this one around a cocktail of antibodies. We are the first hospital in Florida to participate in this trial. This cocktail of antibodies is available in outpatient now, and we would encourage you to call the clinical research department to find out if you're a candidate for that trial. Unfortunately, hurricane season isn't taking a pause this year because of COVID-19. So we need to stay diligent and prepare ourselves for worst case scenarios around hurricanes or tropical storms that may hit the Suncoast area. But I do want to encourage everyone that this is the time of year when we need to make sure our homes and our property are safe and that we have enough supplies to get through any kind of hurricane preparation. So ever since the pandemic started, we've been concerned about staff safety, and we've been conforming to the CDC guidelines. And those have, of course, changed throughout this pandemic as the CDC and as professionals have learned more about this disease. We have a no visitor policy except in extraordinary situations. We are temperature checking everyone who comes in. We're requiring masks in the hospital. We're requiring face shields in the hospital if you're in and around other people. We want all staff to feel like they have the tools they need to do their job, not just PPE, but everything that it takes to do a complete job. We continue to have resources available, particularly through EAP. If you feel like you need to access that, please do. That's there for you, and these are good, caring people that want to help you get through any issues that you have. As this pandemic continues on, we know that burnout and fatigue are big issues in our organization and throughout the community. So we want to be here to support you in whatever we can do to make sure that you feel appreciated and make sure that we can help you if you're feeling burned out or fatigued. We're bringing in contract employees to help relieve some of our employees now. Those are not particularly easy to find, but our teams are doing their best to source people and bringing them in each and every day right now. Throughout this pandemic, the true heroes have been our staff. Our community knows that, the hospital knows that, our board knows that. We just want to express our gratitude for everything that you've done for this community, for this hospital, and most of all for our patients that are here. We want to show our gratitude for your dedication and personal sacrifices. So today we're announcing an appreciation pay for all employees that are in our healthcare system. We wanted to come through for our staff when they come through for us each and every day and put themselves on the line for us and our patients and our community. We have a team looking at ways to continue to say thank you to our staff and express our appreciation each and every day, and I'm sure we are going to have more things to show you in the future. I want to wrap up today's video by once again thanking you for everything that you've done. Even during this pandemic, we continue to be recognized as an incredible organization, both in our community in the state of Florida and the United States. We were recently recognized by U.S. News and World Report as being one of the top 1% hospitals in the country. It is something that we don't chase, but it sure is nice to see when they call us and tell us about this. And we also got recognized as a top 100 hospital by IBM Watson. So thank you, because none of that happens without all your hard work. I also want to thank the community for everything that you've done to help support our staff in this hospital, because without you, none of this happens either. And to remind everyone out there, both our employees and the community, please social distance, wear a mask, and keep washing your hands. Thank you so much. See you soon.